Some medications have a pretty straightforward story. They're made for one thing, they do that one thing, and that's it. But every so often, a drug comes along that's kind of hiding a secret identity, a hidden power that totally changes its destiny. Today, we're pulling back the curtain on one of those pills, misoprostol.
So just think about this for a second. What if the exact same little pill, first designed to keep your stomach lining safe, could also be one of the most important tools we have for saving a mother's life? Well, that's not a hypothetical. That is the incredible and kind of complicated reality of misoprostol. And to really get it, we have to go back to the beginning. Before it became this huge deal in global health, misoprostol had a much quieter and, let's be honest, less dramatic job. It was all about being a bodyguard for the stomach. So what exactly is this stuff? Well, misoprostol is basically a lab-made copy of something our own bodies make, a compound called prostaglandin E1. You can think of prostaglandins as your body's little multitaskers. They do all sorts of things like managing inflammation, protecting your stomach, and this is the important part, making the uterus contract. Now, remember that last bit. It's going to become a really big deal later on. Its original purpose was pretty simple, really. In the stomach, misoprostol works like a three-part security system. First, it dials down how much acid your stomach produces. Second, it ramps up the production of that slimy, protective mucus that shields your stomach lining. And third, it boosts blood flow to the area to help with any repairs. A very, very effective defense.
And that was its official approved mission. So let's say you were an arthritis patient taking a lot of ibuprofen every single day. Your doctor might have given you misoprostol just to make sure those other pills didn't tear up your stomach. It was a specific, important, but pretty narrow job.
But, medicine is just full of surprises. And it turned out that misoprostol's effect on the uterus, the one we just talked about, wasn't just some minor side effect. Oh no, it was an absolute game changer. And this is where the whole story takes a sharp, unexpected turn. This slide just lays it out perfectly. It shows the pill's total double life. Over on the left, you've got its quiet day job in the stomach. On the right, you have its powerful, world-changing night job in the uterus. In the stomach, it's a protector. In the uterus, it's an activator. It kicks off contractions and gets the cervix ready. Two wildly different jobs from the exact same molecule. So how is that even possible? Well, the secret is in the locks on our cells. Think of misoprostol as a master key. Your body has different kinds of locks called receptors on cells in your stomach, your uterus, all over the place. When this master key clicks into a lock on a stomach cell, the message is, hey, cool it with the acid. But when that same key slides into a lock on a uterine muscle cell, it unlocks a powerful contraction. Same key, different doors, totally different results. And this master key effect didn't just add a new trick to the drug's resume. It kicked off an absolute revolution in reproductive healthcare. I mean, it saved countless lives and created new, less invasive options for patients all around the world. And this is where misoprostol becomes a true superstar, playing four critical roles. It's used for medical abortion, causing contractions to end a pregnancy. It works in a similar way to help manage a miscarriage, letting the body finish the process without needing surgery. Doctors also use it to induce labor, to get things started when it's medically necessary. And maybe its most critical job, stopping postpartum hemorrhage. Those strong contractions it causes literally clamp down on bleeding blood vessels after birth, stopping what could be a fatal bleed right in its tracks. And here's why that matters so much on a global scale. A lot of other drugs that can stop bleeding need to be kept cold in a fridge. Misoprostol doesn't. And that one simple fact means it can be tossed in a midwife's bag in a remote village, ready to go at a moment's notice to save a new mom's life. Its stability makes it absolutely essential for global health. Okay, now any tool this powerful has to be handled with a ton of respect. The very things that make it so effective also mean it comes with some serious risks and side effects that absolutely have to be managed by a professional. A lot of these side effects make perfect sense when you think about it. Remember, it's mimicking those prostaglandin multitaskers. So yeah, things like diarrhea, cramps, chills, and fever are pretty common because prostaglandins are involved in all of that. And the heavy bleeding, well, when it's used for abortion or miscarriage, that's actually the intended effect. But, and this is a big but, there are much more serious, though thankfully rare, risks. Sometimes, the contractions can get way too strong or come way too close together.
That's called hyperstimulation, and it can be really dangerous for a baby during labor. And in the absolute worst case scenario, the uterus itself can rupture. That is a life-threatening emergency, which is why medical supervision is non-negotiable.
So that brings us to who absolutely cannot take this pill. First off, obviously, anyone trying to continue a pregnancy. Also, anyone who knows they're allergic. And this is a really important one. It's often avoided for inducing labor in women who've had a C-section before. That scar tissue on the uterus just isn't as strong as the rest of the muscle, creating a weak point that has a higher risk of tearing under intense contractions.
And if you thought that was complicated, get this. How you take the pill completely changes how it works. Swallowing it for an ulcer is one thing, but letting it dissolve under your tongue or placing it vaginally, that can lead to way faster, more powerful effects on the uterus. The dose, the timing, the route, these are all critical decisions that only a doctor or a trained provider can make. So when you put it all together, you get this incredible picture of a pill that's both a humble stomach protector and a life-saving revolutionary force. Its legacy is, well, it's complicated. And this right here, this quote, is the most important takeaway of all. It's a warning that just can't be said loudly enough. Trying to use this drug on your own without a doctor's guidance for your specific situation is like playing with fire. The risks of getting it wrong are severe. They can be catastrophic.
At the end of the day, Misoprostol's story is one of incredible power and profound responsibility. It is an essential, life-saving tool that has changed the world for the better. But it's not a simple drug. It is a powerful instrument that demands knowledge, respect, and constant, careful medical supervision.
So it leaves us with this big question, doesn't it? When we find a simple molecule with this much world-changing power, the challenge isn't just about using it. It's about making sure we always use it wisely, constantly balancing its incredible benefits against its very real dangers.